Thank you, Jonathan. And good morning, everybody. And we appreciate the opportunity to highlight the department's plan for the delivery of COVID-19 vaccine. The department's priorities, as you know, are protecting our service members, our civilian employees and families, safeguarding our national security capabilities, and supporting the whole of government response to the COVID-19 pandemic. As such, and as we'll outline today, our plan will provide the COVID-19 vaccine to DOD uniformed service members, both active and selective reserve components, including members of the National Guard, dependents, retirees, civilian employees, and select DOD contract personnel as authorized in accordance with DOD policy on this topic. I am extremely confident the department's plan, developed in collaboration with Operation Warp Speed and the CDC, provides a very clear roadmap to protect our entire DOD population across the globe against the pandemic. Early in the COVID-19 vaccination program, there will be a finite supply of vaccine. Vaccination distribution prioritization with DOD will be consistent with data-driven CDC guidance for national prioritization. In the coming days, we expect the department to receive its first allotment of the vaccine. Initial phases of the DOD distribution and administration plan are based on the expected limited number of initial vaccine doses allocated by Health and Human Services in the CDC to DOD, and on the department's need to rapidly validate our processes to support increased distribution as vaccine production increases. At this time, DOD is expected to receive just under 44,000 doses of the Pfizer vaccine as early as next week for immediate use. DOD's plan for distributing this vaccine includes monitoring processes to inform senior leader decisions about distribution capacity, increased distribution at administration locations, and our force health protection. Our deliberate and phased approach to distribute and administer this first allotment and future allocations of the COVID-19 vaccine will focus on vaccinating priority populations quickly and safely, while simultaneously refining the intricate planning for the delivery of larger volumes of vaccine in future waves. The department will prioritize DOD personnel to receive the vaccine based on the CDC guidance and on the department's own COVID task force assessment of unique mission requirements. The DOD prioritization plan is consistent with CDC guidance and prioritizes healthcare providers and support personnel, residents and staff of DOD long-term care facilities, other essential workers, and high-risk beneficiaries to receive the vaccine before other members of the healthy DOD population. As mentioned, the DOD plan calls for a phased approach. The initial phase is what we are calling a controlled pilot. In this phase, we will be distributing the vaccine to priority populations in 16 distinct locations. We will monitor the uptake and make adjustments to our plans going forward as necessary and as lessons learned from this controlled pilot. We will continue with this form of distribution, adding additional prioritized personnel and additional prioritized locations until 60% of our DOD, roughly 11 million personnel, have received the vaccine, at which time DOD anticipates vaccine manufacturing rates to support full-scale, unrestricted vaccine distribution to department personnel. At that point, our intent is to distribute the vaccine in the same manner the department conducts its annual influenza vaccine program. If you look at some of the slides we provided, the department selected initial vaccine distribution sites to best support several criteria. Number one, the anticipated unique supply chain requirements for the initially approved vaccines, a sizable local DOD population with priority personnel across all of the military services, and sufficient medical personnel to administer the vaccines and monitor recipients after initial and second dose administration. In his remarks, General Place will provide additional detail on those specific locations. In a recent virtual tabletop exercise led by Deputy Secretary of Defense and senior civilian and military leaders, The DOD COVID Task Force and the leaders responsible for the first phase of the plan walk through the processes in great detail to ensure seamless distribution and dissemination of this initial wave of vaccine across our selected sites. The lessons learned from this exercise help solidify the department's plan on the way forward. In terms of next steps, as soon as the FDA issues an emergency use authorization, DOD's allocation will be pre-positioned at our initial locations. Upon issuance of the EUA, the CDC's Advisory Committee on Immunization Practices will meet, review the EUA, and then vote to recommend the vaccine and how it should be disseminated and who should receive it. We expect to have shots in arms of DOD personnel within 20 to 48 hours from the time the ACIP issues its final recommendation. I want to personally thank the men and women across the department who have spent countless hours, both day and night, supporting the development of this plan. Their preparation for the vaccine of millions of individuals across the department in the coming weeks and months will protect our force against COVID-19 and allow us to continue to fulfill our mission to the nation.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.